with specialists and attendants overpowered, and numerous patients struck somewhere around sickness themselves. Arranged medical procedures have been dropped to assist adapt to the deluge of winter confirmations in clinics in Europe. Across the majority of Europe, medical services frameworks, assaulted for a very long time by the pandemic, are battling with gigantic excesses while they all the while skirmish of COVID, influenza and the respiratory syncytial virus RSV this colder time of year. In Italy, surgeons have cautioned crisis divisions are being pushed as far as possible after influenza cases hit their most elevated level for quite some time, while Spanish specialists have taken to the streets over claims they are by and large constantly exhausted. Experts in France, in the meantime, have suggested individuals wear veils inside again due to the rising number of contaminations. Similarly as with England's NHS, the emergencies are the after-effective momentary harm created by the coronavirus and long-haul issues that have been stewing behind the scenes for a really long time. Subsequent to sidelining everything except the most fundamental consideration during the pandemic, legislatures are currently scrambling to lessen holding up records. In any case, they are shuffling this need with requests for more prominent financing to adapt to more seasoned and more debilitated patients, while expansion destroys their spending plans. The UK seems to have been hit harder by a larger number of people of these difficulties, yet their makes, from maturing populace's staff deficiencies, are normal all through the created world. Specialists caution there are no simple or handy solutions for the vast majority of these issues. Before long, they will provoke looking through inquiries regarding the arrangement of medical care and how it ought to be overseen without bankrupting the West. There were at that point signs that medical services frameworks in the European Union were under strain before the pandemic, in spite of the fact that exhibition across the alliance differed essentially. In numerous nations this came after states looked to fix their accounting reports following the monetary emergency, managing well-being spending or easing back increments. Germany, Spain, the Netherlands, Norway, Austria and Finland figured out how to somewhat keep spending plans level or raise them. The ascent of more complicated well-being needs and level or falling subsidizing agreed with developing holding up times by and large. They have moved in Ireland, Portugal, Spain and the Netherlands soon after the monetary emergency. In Ireland, the public authority had been engaging fruitlessly to cut down hanging tight records for quite a long time, with specialists' affiliations pinning the issue on an absence of beds and prepared staff. The coronavirus pandemic then managed an overwhelming catastrophe for all well-being administrations, as it constrained them to focus on critical consideration for the gigantic flood of COVID patients and put off non-crisis methodology as they wrestled with the emergency. Later endeavors to guarantee populaces were inoculated likewise sucked up time and assets. During that period, many individuals stayed away from visits to the specialist or missed arrangements, inspired by a paranoid fear of becoming tainted or adding to burden on the framework. Yet, the arrival of patients looking for care once more, combined with more restricted accessibility as well-being administrations actually wrestle with COVID and other respiratory illnesses this colder time of year, is coming down on holding up records. It implies more patients could see their circumstances deteriorate. What's more, likewise with the underlying shock of the pandemic, a few nations are managing the resumption of typical administrations better than others. Like in the UK, the result of the pandemic has heaped strain on medical care frameworks across Europe also. Influenza and other respiratory infections have returned thundering as life gets back to business as usual, while approaching under additional intense issues is the primary shift towards a more older populace experiencing more persistent circumstances. In the meantime, numerous medical services staff, depleted from the pandemic, are peering toward the exit. The central point of contention behind limit issues in both the well-being and social consideration frameworks is staffing. What's more, albeit these worries are not new, they have taken on another significance after the pandemic. This is adding to existing staff deficiencies, while insufficient youngsters are going into preparing. Fatigue from the pandemic and inflationary tensions are likewise making many staff consider stopping their positions across Europe, with discontent obvious in the broad strikes tormenting the mainland. Medical clinic wards across the landmass keep on topping off, and holding up records prolong. Adapting to these new difficulties is simply going to become more enthusiastically, whether it is in Sweden, Italy, England or somewhere else.